Welcome back to Take Charge. I'm Jennifer Zabasaja.
And I'm Tim Stenevec in New York. Well, it's been about 6 months since the first Americans were vaccinated back in December. And the big question is when and if they're going to need to start scheduling their booster shots. Bloomberg Intelligence's senior pharmaceutical analyst, Sam Fazeli, says we'll likely need to boost within 6 to 9 months after the first 2 shots. And Pfizer has said that it's planning to examine some real-world data to track how long immunity lasts. Here to discuss is senior scholar with the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health, Dr. Amish Adalja. Dr. Adalja, always great to see you. Thanks for joining us on this. You were among the first people I knew to get a vaccine months ago, and I'm wondering if people within your universe, medical professionals, are starting to prepare for their booster shots.
No, we're not. I was vaccinated. My first dose was before Christmas, so I'm already at that 6 months mark. And I'm not somebody who thinks that we're going to need boosters in the short term. I don't think we can really telegraph when we're going to need boosters or if we're going to need boosters. What we have to do is watch people who are fully vaccinated and see what happens to them. And what I mean by see what happens to them, it's a clinical type of diagnosis. Are they getting breakthrough infections that are severe enough to land them in the hospital or that are contagious? That's not what's happening right now. So I don't think that we're going to need booster shots in the near term. Maybe sometime down the road, but I don't think you can predict what the future is going to be. You get a general idea because certain vaccines do require boosters, like the tetanus, for example, but certain ones do not, like yellow fever or measles. You get 2 doses and then you're done for life.
Dr. Adalja, I've heard you say that we need to start learning to live with COVID even after the pandemic is over. Can you just explain what that is like and what that's going to be like for everyday people?
So you have to remember that COVID is not going to be some disease that gets eradicated like smallpox. It is a respiratory virus with an unknown animal host that comes from bats, so that it's going to remain on this planet. And what we're trying to do is really remove its ability to cause serious disease, hospitalization, and death. So it becomes more like other respiratory viruses that we deal with year in and year out, like influenza, parainfluenza, RSV. There's a whole host of them. And we know that there already are 4 coronaviruses that circulate every year and cause about 25% of our common colds. That's what we're trying to do. That's why we're getting high-risk people vaccinated to the highest degree possible. Over 75% in the United States have been vaccinated so that you don't have hospitals going into crisis. But there's not going to be a time where somehow this virus goes back into bats and it's not a threat that we deal with. It's just going to be a much lower level threat. And I think that's why people have to get their risk calculations in order, because they're not going to magically go back to 2019 and not have a COVID risk. It's something that you're going to have to think about, just like you have to think about influenza and adenovirus and rhinovirus and all those other viruses. That's where this is headed. And I think many people kind of delayed that recognition. And I think there was a lot of bad messaging where people somehow thought this was going to disappear and go to zero.
Well, speaking of risk calculation, I want to bring up the Royal Caribbean example because we learned late yesterday that the company is delaying its cruise as staff tests positive as of June 15th. The company's president and CEO said in a Facebook post that all 1,400 crew on board Odyssey of the Seas were vaccinated on June 4th and will be considered fully vaccinated on June 18th. 6 of those who tested positive were asymptomatic. 2 have mild symptoms. Is canceling the cruise the right move here if there is such a high level of vaccinations?
I think you have to kind of look at these on a case-by-case basis. Obviously, I would advise Royal Caribbean, and I did some consulting with them early on in the pandemic for full disclosure, that you would want to have your crew fully vaccinated before you embark. And if there were people that were in between first and second doses or just got their second dose and hadn't been 2 weeks, you may see infections there, which aren't true breakthrough infections. But the other point is that you should not be testing fully vaccinated individuals. If someone has had 2 weeks since their last dose of whatever vaccine they were supposed to get, there's no reason to test them unless they're symptomatic, because what we're picking up are these asymptomatic breakthrough cases that aren't really clinically meaningful. They're not necessarily contagious. The same thing happened with the New York Yankees. We've got to move away from that because what we've done is change this virus. We've tamed it. So in the United States, it's not necessary to be doing that same kind of screen testing on people who are fully vaccinated. And you're going to continue to get these positive tests, which don't really change anything clinically. So I think we really have to shift our whole risk perception, not just at the individual level, but at an organizational level, to become comfortable with the fact that there are going to be COVID cases there. We've got high enough vaccination that we'll never see hospitals go into crisis in the United States. And we've got to kind of move forward because we're not going to get to zero. And there's always going to be these cases that appear. And I think the Royal Caribbean example is something that is just proof of that concept. But if they were not fully vaccinated, I think it's a different story.
And Dr. Adalja, do you stand by that even when thinking about the Delta variant? I mean, a lot of people are concerned about this specific variant. Do you still stand by that statement when you think about sort of this other variant that's spreading around?
Well, the Delta variant, the best solution to the Delta variant is to vaccinate your population as fully as you can. And if you are a fully vaccinated person, especially with the Moderna and Pfizer vaccines, both doses, you are going to be fine when it comes to the Delta variant. The data is very strong that if you're a fully vaccinated individual, the Delta variant is no different for you. The vaccines work against these variants. The challenge is getting vaccines into people's arms. Whatever the virus is throwing at us, our vaccines are able to handle. That's a good thing. So I am concerned about the Delta variant in unvaccinated populations spreading and causing a lot of disruptions. But in the United States, I think so many of our high-risk people are fully vaccinated. So even if you look at a state like Mississippi, which is one of the lowest overall, if you look at above 65 years of age, the majority of those individuals are fully vaccinated. So even in a state like Mississippi, you might see the Delta variant spread in unvaccinated populations. But would it put their hospitals into crisis? No. Hospitalizations might go up, but it's going to be a very different flavor than what we saw in Christmas or earlier.
Absolutely. Well, Dr. Adalja, we always appreciate your time. That is senior scholar with the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health, Dr. Amish Adalja. Thanks as always for your time. And we should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.